Hey guys, today I'm going to be talking to you guys about the dengue vaccine. So the vaccine name is Dengvaxia. This vaccine is available in the U.S. for use in areas with high risk of dengue, and the Dengvaxia is the brand name for chimeric yellow fever dengue tetravalent dengue vaccine, also known as CYD-TDV. This picture right here shows you the three components that come in the packaging. So the CYD-TDV is a live attenuated vaccine that contains the four structural proteins that are embedded in a yellow fever RNA polymerase backbone virus. They use the yellow fever virus because it's under the same genus, the flavivirus, as the dengue vaccine. So structurally, it's very similar. The only changes that they do is in the polypeptide backbone, where they replace with dengue wild serotypes, as you can see here on the right, the DNV1, 2, 3, and 4. Immediate activation of the immune response is seen upon injection of the vaccine, with increased expression of macrophages and dendritic cells, which are the target cells once the cell is infected with the dengue virus. Memory T cells reproduce at a faster rate, and that creates a robust response towards the same antigen if there were to be a subsequent exposure to the DNV1, 2, 3, or 4. So the infectious disease and the infectious agents, the dengue virus is under the genus of flavivirus. It's a single-stranded RNA virus. Other members of the same genus include the yellow fever virus, West Nile virus, the Zika virus, as well as the chikungunya virus. Dengue fever is also known as the breakbone fever because of the intense muscle spasms that the virus causes in a body that causes bones to just basically snap in half whenever you have that contraction. Some of the characteristics of dengue. The mode of transmission is through mosquitoes. The primary vectors are mosquitoes, specifically the Aedes aegypti and the Aedes albopictus. The female mosquito of the Aedes aegypti is associated with most infections, but the albopictus range is expanding. Research has come to show that the albopictus is starting to increase the levels of infection as well because they can withstand harsher environments such as decreased temperatures. They can last longer without eating, so the time between bites is longer, but whenever they do bite, it's a harsher introduction to the virus. For the pathophysiology of dengue, it's a little unclear still. There hasn't been much research on the mode of physiology that the virus shows. But we do know the macrophages and dendritic cells in the skin are the primary targets. The infected cells travel to the lymph nodes and travel along the lymphatic vessels to other organs. What's also interesting to note is that the Aedes aegypti mosquito is not only carrying the vector disease of the dengue. This mosquito is also known to carry the virus for the Zika virus and the chikungunya virus. So yeah. So as you can see in this picture right here, it shows a diagram, a little bit of the pathophysiology that we do see with an infection of dengue virus. Whenever the mosquito does infect, it does so by injecting itself into the epidermis, targeting those keratinocytes in the epidermal layer. That injects the DNV virus into the dermal layer, first targeting those dendritic cells and those macrophages with the viral DNA in it. Also, whenever you do have the initial encounter of the DNV virus in the cell, there's going to be activated mast cells that are going to release cytokines for some kind of reaction towards the viral DNA. Once those dendritic cells and infected macrophages are infected, they are going to be trafficked to the lymph node and travel throughout the body through the lymphatic vessels for the infection and inoculation in other organs that will cause, harsher symptoms. Some symptoms that are related to the dengue virus, strangely enough, it is asymptomatic in 75% of the infections, but there are three phases of the dengue. The febrile phase is characterized by very high fevers, up to 40 degrees Celsius, that'll last you 2 to 7 days. Other common symptoms in this phase are facial flushing, joint pain, headache, sore throat, eye infections, nausea, and vomiting. Moving on, after those 2 to 7 days, you go into the critical phase. The critical phase is known for its chance of hemorrhage, having a hemorrhagic fever. Although the decreased fevers are a main aspect of this phase, being around 39 to 38 degrees Celsius. But it's also known for its increased capillary permeability, usually lasting 1 to 2 days. There's a massive and a rapid incline in the platelet count for the infected patient, which leads to shock and hemorrhage, like I said before. Given proper medical care and healthy enough, depending on the level of healthiness of the patient, they do move on into the recovery phase, which lasts 2 to 3 days, and the body is usually reabsorbing that extravascular fluid that was released during the critical phase. The main symptom here is bradycardia, while your body is overworking itself for the reabsorption of the extravascular fluid. The mode of diagnosis that the literature is currently showing, it's a very wide range for the dengue virus, but it is the virus antigen is detected by ELISA, PCR, virus isolation from bodily fluids, and it's firmly confirmed by PCR and serologic testing. When a patient is showing signs and the symptoms of dengue, the common laboratory findings that can aid in the diagnostics of dengue fever are thrombocytopenia and leukopenia, which are blood tests that can determine the levels of thrombocytes and leukocytes. Thrombocytes are going to be the ones that are causing that, causing the thrombosis of the cells, causing it not to leak out. And the leukocytes are just white and red blood cells. So the diagnosis timeline looks like a complete blood test, PCR test, and antibody to detect the dengue virus type, and also the liver function test to detect any unusual levels of enzymes that can cause a disbalance and lead into shock for the patient. The incidence of dengue, dengue affects more than 100 million humans annually throughout the world, with 20 to 25,000 deaths in children. Found in more than 100 countries, the epidemics are usually occurring in the Americas, Asia, Africa, and Australia, as shown in this map right here, being concentrated in South and Central America, very highly concentrated in the Central African countries and Asian countries along the Philippines as well. The vaccination schedule for the Dengvaxia is 6 months apart after you are already confirmed that you are infected with the virus. So in order for you to receive this vaccination, you need to have a prior infection, either being from the DNV 1, 2, 3, or 4. It doesn't matter, but it needs to be medically proven that you were infected. This vaccine is FDA approved, but it is reserved for individuals with an established prior infection. The vaccine should not be administered to children under the age of 9 and over the age of 16. as well as if you are in that age gap and you are immunocompromised, the child should not be receiving this dengue vaccine. Um, the doses are 6 months apart, like I said before, and they provide protection against the dengue virus for at least 6 years. But there's a lot more data and literature coming out showing that it could be longer than that. The route and components of the dengue vaccine, it is administered by a licensed medical profession and given to the patient subcutaneously with a total of zero point 0.5 milliliters. It is presented as a suspension, like I showed in that first slide, having the three vials. It is composed of the sodium chloride solvent and an antigen powder that are reconstituted before used. And the licensed medical professional has the training to know the measurements that need to be put into a syringe and administered properly. As with any immunization, there are side effects. There are those that you want and those that you don't want. Any vaccine, you're going to have soreness at the site of injection. You're going to have those tired feelings, nausea, any unwell feeling. That's normal with an injection as you are initiating an immune response. But with Dengvaxia, there are possible rare side effects that may not even occur. These side effects occur in about 0.1% of all the patients who have received Dengvaxia. And some of these occur even less than in 0.1% of the patients. These symptoms are bleeding in the mouth, cough, fever, vomiting, stomach discomfort, swollen and painful lymph nodes in the neck, armpit, and groin regions. But shortness of breath and chest pain can also occur, but like I said, in less than 0.1% of those patients. The public perception with Dengvaxia, there has been some backlash. In 2017, there was a very big backlash, and especially in the Philippines, when a pediatrician and a medical researcher was indicted for introducing the Dengvaxia vaccine in the market too early without proper research and clinical background of study in the vaccine. The French company that manufactures this later came out with a statement saying that the vaccine was not to be administered to anyone that hadn't been previously infected with the dengue virus. And then this pediatrician was charged with a bunch of counts and later sentenced to 48 years in prison in the Philippines. But after further research occurred, the vaccine was later approved for administration in children who had the previous infection and became FDA approved. For the recent events after the public backlash that occurred in the Philippines, the vaccine was approved for use in Europe in 2018 and approved for use in the US in 2019. And the controversies of the vaccine that the Filipino children were used as guinea pigs were dismantled after more data was available for the researchers to determine the actual efficacy of the vaccine. Now there is a current epidemic of the dengue virus occurring in Brazil, and this is the main reason that I decided to do this presentation. There are over 1 million cases already recorded since the beginning of March in Brazil, and numbers are skyrocketing with no end in sight. As you can see here on the map, these areas that are highly red, that are very red in 2022, are the areas in Brazil that have been mostly affected by the dengue virus as of now. I have had family members with dengue virus, but they were fortunate enough, and we were fortunate enough that they were healthy, and we were able to get them the proper medical care that they needed. Anyway, I hope you guys enjoyed that. These are my works cited, and I can't wait to hear your questions on Wednesday. Thanks, guys.